wait. If you have been down with a fever, body aches, or a mild cough for the past few days, watch this video to the very end, because these 3 symptoms are often ignored by most people, thinking them to be normal flu. And this is the biggest mistake. I have personally seen around me in my neighborhood that people say, "Friend, it's just seasonal flu. I'll be fine in 2 days." Then on the 3rd day, they are in an emergency. Doctors themselves are worried that this year's flu is behaving differently than before. The symptoms appear to be the same, but something else is going on underneath. Today, I'll share 3 warning signs that, according to medical experts, should prompt a visit to a doctor without delay. And at the end of the video, you'll also find a simple guide on how to do your first checkup at home. Let's get started, because this information might just save someone's life. Friends, let's make one thing clear. First of all, this video is not meant to scare anyone. It is meant to inspire you. Every year, the winter season brings a surge in flu, viral infections, and respiratory illnesses. But this year, some doctors and health experts have noticed that among people who come in with normal flu symptoms, some are worsening more quickly than they used to. This could be because the immune system is already weakened after the winter or previous illness. Different virus strains are active simultaneously. People do not take the alarm seriously and remain at home to wait and watch. Now, the question is, how to differentiate between a normal flu and a serious infection. Because initially, the symptoms of both are quite similar: fever, cough, body ache, weakness, but there are 3 signals that tell you this isn't just a normal flu. Medical attention is needed. And today we'll discuss these 3 things in detail. I want you to watch this entire video because with each point I will tell you why it is important, what is actually happening in the body, and when to worry and when not to. Peli alamat, or Sai Leni Main. Let's start with the first and most important element: difficulty breathing or feeling tightness in the chest. What happens with a normal flu? You have a stuffy nose, a cough, and a slight sore throat. But breathing isn't difficult. You can move around comfortably and talk. But if you feel that, even a short walk or a short climb makes my breathing easier, which was not the case earlier. It is becoming difficult to breathe while lying down and I have to sit. There is a heavy pain or swelling in the chest, as if something is stuck. There is a wheezing sound while breathing, so it's not just a flu symptom. It's a sign that the infection has spread to your lungs, or that your oxygen levels have started to drop. Why does this happen? When a respiratory virus enters the body, it normally stays confined to the upper respiratory tract, nose and throat. However, sometimes, especially when the immune system is weakened or the virus strain is more aggressive, the infection can travel down to the lungs. There, it creates inflammation, which leads to fluid or inflammation in the air sacs, alveoli, in the lungs. This is what can lead to viral pneumonia. And when the lungs don't function properly, the oxygen supply to the body decreases. This directly affects the brain, heart, and the entire body. How to check at home. If you have a pulse oximeter, a small device that goes on your finger, check your oxygen level, SpO2. A normal level is 95% or higher. If it's 92% or lower, it's a warning sign. But if you don't have one, here's a simple test. Try talking for 30 seconds at a normal pace without stopping. If you find yourself repeatedly stopping to take a breath or running out of breath before you can complete a sentence, that's an alert. When should one go abroad? If the lips or nails turn blue or purple. If breathing becomes so fast that normal conversation is impossible. If breathing is difficult along with chest pain. These all fall into the emergency category, where delaying can be dangerous. But if you feel slight shortness of breath and also have fever, then it is best not to wait more than 24 hours and talk to the doctor, even if it is a consultation over video call. Second alarm. Faster than 3 days, it will come back again and again, 9 o'clock, 15:30. The second alarm is fever that returns after getting better, or that continues for more than 3 days. Normal flu fever follows a pattern. The temperature is high for the first 1 to 2 days, then gradually decreases. The fever subsides within 3 to 4 days. But if you look at fever has been continuing for more than 3 days and is not subsiding. One day your temperature returns to normal, you feel better, but then the next day you get a high fever again. Fever with severe chills. So this could be a sign of a biphasic fever pattern. That is, a fever that comes in 2 stages. This pattern is seen in certain infections where the body, after recovering from the first wave, is then confronted with a second wave, or secondary infection. What does this mean? When the first viral infection subsides, the immune system temporarily relaxes. During this time, if bacteria, which are normally under control, take the opportunity to invade, a secondary bacterial infection occurs. This often occurs in the form of lung, pneumonia, sinus, or ear infections. This is why doctors say, if you get a fever again after recovering from the flu, it could be a sign of another illness, not just the flu getting worse. Let's talk about temperature numbers. A fever of 100 to 101 degrees Fahrenheit, generally in the normal flu range. Higher than 102 degrees Fahrenheit and not brought down by medication. This is a matter of concern. 104 degrees Fahrenheit or higher. This is an emergency level, especially in children and elders. The role of the chills. If the fever is accompanied by intense chills that make your body shake, your teeth chatter, and you feel cold despite being wrapped in a blanket, it's not just a high temperature, but a sign of a heightened inflammatory response within the body, especially if these rigors, intense shaking chills, occur repeatedly at night. What to do? Make a fever chart. Note the temperature 2 to 3 times a day. If the pattern is up, down, up, or the fever lasts more than 72 hours, 3 days, then consultation with a doctor is necessary. If the fever is accompanied by confusion, vomiting, or extreme weakness, this is not the time to wait. Remember, a fever isn't a disease in itself. It's a response from the body. But when the response becomes so prolonged or severe that the body can't control itself, medical help is necessary. Tisri alamat, shadid kamzori, confusion or failure to work in Rosanna. The third and final feature, perhaps the most overlooked, is shaded weakness, confusion, or so weak that even work becomes difficult. This is a subtler symptom because feeling tired is normal with the flu. Everyone experiences it. But what's the difference? With normal fatigue, you rest, sleep, and feel better after a few hours. You can get up on your own to drink water, go to the washroom, and talk. But agar, you or someone close to you becomes so weak that it is difficult to even get out of bed. Confusion, such as not being able to speak clearly, answer questions correctly, or seem disoriented. Excessive sleepiness and difficulty waking up kanapina chodna, especially panina pisakna. So these are all signs that something more serious is happening inside the body. This could be a sign of dehydration, or that the falling oxygen levels in the body have started to affect the brain, or that the infection has become so severe that the body has become overwhelmed. Understand the role of confusion. Our brain is one of the most demanding organs in the body. It needs constant oxygen and glucose. When inflammation increases due to infection in the body, or oxygen levels fall, or dehydration sets in, brain function is the first to be affected. Therefore, confusion in elderly people is considered a red flag, because their body reserves are lower. This is also seen in children. If the child is more lethargic than normal, does not respond, or is not playing at all like they usually do, then it is not just tiredness. Signs of dehydration: dry mouth and lips, decreased urination, or darkening of color. Sunken eyes, feeling dizzy when standing. If the fever is accompanied by vomiting or loose motions, dehydration can occur very quickly, especially in children and the elderly. Why is this third property the most underestimated? Because when we are sick, we think, if I just sleep more, I'll be fine. But when a person is unable to assess his own condition, it becomes the responsibility of a family member or companion to observe and make a decision. If you are with someone who has a fever and you notice that he is answering normal questions in a confused manner. I am not able to get up and take water on my own. He is sleeping continuously and is not responding properly even when woken up. So this is not the time to wait. This is the time to seek immediate medical attention. What should all of these be together? Red flag combination. Now here is an important thing to understand. No single condition individually can be as serious as when it comes in combination. For example, just a little fever, normal. Just a little weakness, normal, but high fever, plus difficulty breathing, plus confusion. All three together are a red flag combination. Doctors often use a simple approach called trajectory. That is, what is the trend of the disease? Is the patient getting better day by day, or is it getting worse? If there is no improvement after 2 to 3 days, but rather the condition is worsening, this is a sign that the body is not coping on its own, and it needs help. The purpose of this video is not to make people rush to the doctor for every small fever, but rather to make them not ignore the signal when the body is clearly signaling, I can't handle this myself. Section 5. What to do at home now. Practical steps. Now let's talk about something practical. If you are experiencing these symptoms or seeing them in someone else, what should you do now? 1. Hydration, drink water, ORS, oral rehydration solution, or light broth. Dehydration can worsen any condition. 2. Temperature monitor, Karen. Note the temperature every 4 to 6 hours. Observe the pattern. 3. Oxygen, check if possible. Having a pulse oximeter at home is a good investment, especially when someone in the household is sick. 4. Rest, but monitor. Rest is necessary, but if someone is sick at home, check every few hours, whether he is responding properly, whether he is drinking water. 5. Use telemedicine. If a trip to a foreign clinic isn't possible, video call consultations are a good first step. The doctor can also remotely guide you to observe at home or visit you abroad. 6. Emergency numbers ready rockin'. Write down the number of your nearby hospital, ambulance service number, so that you do not waste time in case of emergency. Section 6. In a cure, is it reason to panic? 30 minutes, 33 minutes. Friends, I'm by no means saying that every fever is an emergency. In more than 90% of cases, the flu clears up on its own, with rest, water, and time. But the information I shared today is so that when there is that 10% case where the body needs extra help, we can identify it in time. It's sometimes right to wait and see in health matters, but when all three symptoms, respiratory difficulty, prolonged or recurring fever, and shaded weakness/confusion, appear together or separately, the time for waiting is over. Observing your own body and those of your family, especially children and the elderly, is a responsibility. And if you ever have any doubts, it's never a bad idea to talk to a doctor.